Welcome back to The Explainer. Today we're doing something absolutely crucial. We are decoding the body's hidden signals. Often our bodies are trying to tell us something really important, but we just don't have the vocabulary to translate the message. So today we're going to look at a fascinating breakdown of exactly how your body visually signals that your internal engine is struggling. Okay, let's dive into this. Think about your day-to-day life for a second. You ever experience this just unexplained fatigue? Or are you constantly cold, even when everybody else in the room is perfectly comfortable? Maybe you've noticed your skin getting unusually dry, or your weight creeping up, even though you literally haven't changed your diet. It is so incredibly easy to write these things off as just getting older or, having a bad week. But what if those mysterious symptoms are actually your body's motivation engine crying out for help? What if it's actually a thyroid issue? Here's our roadmap for today. We'll be covering the basics of Hashimoto's, warning signs you'll find on the face and neck, abnormalities in the limbs and skin, some hidden systemic SOS signs, and finally, simple testing and treatment. Let's move to the first part and see how this builds. Section 1, the basics of Hashimoto's, understanding the body's metabolism engine. Now, before we really get into the anatomy, I want to emphasize this number right here, 14. Today, we are covering exactly 14 actionable, highly visible self-check signs. These aren't just vague feelings. These are physical clues you can literally look for in the mirror or feel with your own hands. So what exactly is Hashimoto's disease? Well, picture your thyroid. It's a small, butterfly-shaped gland located right around the Adam's apple in your throat. Think of it as the organ that pumps out your body's motivation hormones. It basically tells your body to turn up the heat, generate energy, and keep your metabolism running smoothly. Hashimoto's disease, which is proudly named after the Japanese physician Dr. Hikaru Hashimoto, who discovered it, is a condition where your own immune system basically gets confused. Specifically, these things called TPO antibodies mistakenly start attacking that little butterfly-shaped gland. And because of this attack, the thyroid's function drops, meaning it just can't produce enough of those vital motivation hormones. To really wrap our heads around the impact of this, let's look at a quick comparison. A normal thyroid state means your metabolism is up, your body heat is well regulated, and your skin retains its natural moisture and oils. But in a lower thyroid state, like you'd see with Hashimoto's, the engine slows way down. Your heat drops, moisture is lost, leading to this incredibly dry skin, and your metabolism essentially plummets, which very often leads to that unexplained weight gain we talked about. Section 2, warning signs on the face and neck. Visible clues you can see right in the mirror. Now, what's really interesting about this next part is how obvious some of these signs actually are once you know to look for them. Okay, here are the first 5 visual clues you can check for right now. Number 1 is a swollen throat or thyroid. If you swallow some water and notice the area around your Adam's apple bulging, or if it just feels unusually large to the touch, that is a prime indicator. Number 2 is puffy eyes, specifically a condition known as myxedema. Now listen, this isn't just normal water retention from a bad night's sleep. A sluggish metabolism actually causes these gelatinous substances to pool right under the eyes, making your face look swollen and heavy. Number 3 is a swollen tongue, and this one is highly critical. If the muscles in your tongue swell with that exact same gelatinous substance, it can physically block your airway at night, which dangerously leads to severe sleep apnea. Number 4 is thinning hair, which happens as your hair growth cycle literally loses its metabolic power. And number 5, while definitely rare, is facial distortion or even paralysis. A severe drop in thyroid function can actually cause muscle changes that mimic true facial paralysis. And that brings us to sign number 6, which is so incredibly distinctive it actually has its own historical name, Queen's sign. Because your hair cycle's metabolism is so intimately tied to your thyroid hormones, a drop in those hormones can cause you to lose hair specifically on the outer third of your eyebrows. It's an incredibly specific visual clue, and it's one you can spot immediately just by looking in the mirror. Moving on to section 3, abnormalities in limbs and skin. We're tracking changes in your extremities now. Go ahead and take a look at your hands and feet for this one. If we look at finds 7 through 11, the skin tells a truly dramatic story. Number 7, dry, rough, and even darkened skin. See, your thyroid helps regulate your skin's cell turnover and moisture. Without it, well, you get number 8, thick, almost elephant-like skin on your limbs as old keratin just stubborn builds up instead of naturally shedding. Number 9 is brittle, wrinkled, or deeply ridged nails, which are suffering from that exact same lack of cellular turnover. Number 10 is super fascinating. Numbness in the hands, specifically a noticeable loss of pinch strength in your fingers. A lowered thyroid function is actually highly correlated with carpal tunnel syndrome. And number 11, extreme glove and stocking coldness. We're not talking about a slight winter chill here. This is a severe, almost frostbite-like loss of blood flow to the exact areas where you would wear gloves or socks. It can become so remarkably cold that it literally wakes you up and disrupts your sleep. And then we have sign number 12, which honestly might be the most surprising of the whole bunch: orange palms. Now, why on earth would your hands turn orange? Well, foods like carrots and pumpkins contain a lot of beta-carotene. In a healthy body, your thyroid hormones help metabolize that beta-carotene directly into vitamin A. But when your thyroid is sluggish, it completely fails to make that conversion. So the beta-carotene simply builds up in your system, literally turning the palms of your hands a very uncomfortable shade of orange. Section 4. Hidden systemic SOS signs. This is what happens when the whole body struggles, and it might just feel like you're having a mysteriously bad day. Signs 13 and 14 are systemic. 13 covers sudden mood drops and irregular periods. Your autonomic nervous system relies incredibly heavily on thyroid hormones to keep you energized and to regulate reproductive cycles. So when those hormones drop, your mood absolutely crashes and your cycles become highly irregular. Finally, sign number 14 is stubborn, unexplained weight gain. Because your internal engine has essentially powered down, your baseline calorie burning just drops off a cliff. So the crucial point is this quote right here: do not just diet harder. Listen, if you are gaining weight because of Hashimoto's, punishing yourself with heavy exercise and extreme restrictive diets is actually dangerous. You are basically forcing a broken engine to work harder, which completely wastes what little power your body has left and can severely worsen the whole condition. You absolutely have to address the root cause, not just the symptoms showing up on the scale. Section 5, simple testing and treatment. Taking action without the panic. And this brilliantly illustrates how the medical side of this is surprisingly straightforward. You don't need any highly invasive procedures here. A doctor can check exactly what's going on with a very simple blood draw. They're looking at 3 specific markers: TSH, which is essentially the brain signaling the thyroid, alongside free T3 and free T4, which are the actual active hormones circulating in your blood right now. If those markers do show your engine is failing, the solution is, well, equally logical. Treatment generally just consists of hormone replacement therapy. You're simply taking a medication that effectively restores those missing motivation hormones back to your body's engine, which allows your metabolism, your skin, and your overall energy to return to their normal, healthy state. Okay, and just to lighten the mood a bit before we wrap up, I've got a fun piece of medical trivia for you. If you ever find yourself walking around Harajuku, Tokyo, you might just pass by the famous Ito Hospital. Now, they specialize entirely in thyroid care, and if you look closely at their logo, it is thoughtfully designed in the exact shape of a butterfly, a really clever nod to the shape of the thyroid gland itself. It just goes to show you how specialized and deeply well understood this kind of care has become. So I want to leave you with this final, really important question. What is your body trying to tell you today? We've explored 14 distinct visual and systemic signs today, from the outer edge of your eyebrows disappearing to the orange tint of your palms. The truly brilliant thing about understanding these signals is that you no longer have to be a passive passenger in your own body. You now have the exact vocabulary you need to go to a doctor and just confidently ask for a simple thyroid test. Thank you so much for joining me on this explainer. Stay curious, stay observant, and I'll see you next time.